the instant cosmetic surgery expert. How often do you see that today on social media? Welcome back to Rohrich Knows Best podcast, helping you become a better and more informed you. Hi, I'm Drrodrohrich. I'm a board-certified plastic surgeon in Dallas, Texas. So let's talk about social media and the era of the instant cosmetic surgery expert. You know, I think everybody is famous, world famous on their Instagram or on their website, but are they truly famous? Are they truly good? Are they more godlike? Let's take a deep dive on this. And, you know, it's a true myth. You know, truly becoming a master in cosmetic surgery doesn't happen in an instant. It takes a long time. So, you know, can you become an instant expert in cosmetic surgery on the internet? Yes. In reality, absolutely not. You know, mastery takes years of training, humility, and discipline. And it's a painful process. I mean, you know, there are really 5 things that make you a true expert. It's your extensive training, your incredible deep experience, your expertise, your ability to teach and mentor, and then to contribute scientifically and to give back. And then with that, you earn peer respect. Those are all the stepping stones in becoming a true expert. And no matter what you do. So you have to train rigorously in residency and fellowships. You know, becoming a plastic surgeon takes at least 6 to 8 years of training post-medical school. You know, you have to undergo all types of training, both reconstructive and cosmetic. They build on a platform of your anatomy, your judgment, and technique. And every case builds skill and expertise. Remember that. You don't just get it on a weekend course or even a year course. It comes from thousands of surgeries, not just a viral video. I've done over 30,000 procedures in my career. And the complex reconstructive cases make you, and they can break you, but they build artistry and safety. And experience transforms knowledge into intuition. That's so critical. And then the ability to mentor and teach and lead really reinforces mastery and precision. And that is so critical. And we create and help teach the next generation. So is plastic surgery a team sport? Well, it maybe starts that way, and I certainly teach people every day from around the world. I have global visitors every week, and I contribute through science and scholarship and all of the major journals, having been editor of our major journal, the Journal of Plastic and Reconstructive Surgery. But in the end, it's you and the patient facing that challenge of the day, in this case of rhinoplasty, what to do, what not to do, to give the patient the result they desire based upon your experience, your expertise, and your ability to deliver exceptional results. That's the key. So you want to be able to do that day in and day out, and that's through the consistency that you build with experience and expertise. So there is no shortcut to mastery. It takes years of training and dedication, and true experts, they inspire confidence, not just clicks. Just remember that. And I think that's really what makes you excellent. And it's really purpose, passion, and positivity. There's no shortcuts. And reconstructive surgery makes us the best surgeons, by far. My ability to become an expert in cosmetic surgery really grew from the roots of reconstructive surgery. My ability to care, compassion, and confidence all grew from those foundations. I'm doing hand, micro, craniofacial, pediatric plastic surgery. We build and rebuild what was broken, and we can perfect what is whole. That is so important. And taking a patient, you know, that has significant dog bite injury and restoring them, or restoring a thumb from a great toe, and doing that with the mastery of using microsurgery, that is artistry, and that truly helps you become a better plastic surgeon. And those were the roots of how I developed into plastic surgery. But you know, there are 5 key traits for making someone excellent. It's vision, focus, perseverance, positivity, and work. But of all those, it's perseverance and work that really, really stand out. the ability to work harder than anyone else, have the discipline to make sure that you stay the course no matter what. And really, that hard work and perseverance is what makes you or breaks you, and that is so critical. I grew up in a German-Russian community, in a ranch and a farm, and actually that gave me the work ethic that really helped to transform me into doing what I love to do, and that's plastic surgery. And that's the passion, the positivity, and the ability to persevere that makes you that person. And there's no other way to do it, and that's really called true grit. And true grit is really a combination of passion and perseverance for long-term goals. And really, you're taught that in medical school, that ability to persevere no matter what. And the complexity of reconstructive surgery teaches you three things, the three Ps: precision, patience, and problem solving. And precision of the cleft lip repair. There's nothing like it. The precision of repairing somebody's cleft lip to restore their face, their life forever. And then the patience of burn reconstruction, of taking someone who's severely burned and then reconstructing them over time and giving them hope and life back to them is remarkable. And the problem solving of patients that have undergone either traumatic injuries or tumor resection to give them their life back is really, really a powerful message. And all of this shapes my career in facelift and reconstructive and rhinoplasty, because great artists are first master craftsmen, and everything aesthetic is reconstructive at its core. Whether it's a complex nasal reconstruction, as in this patient where I built her nose on her forehead, to reshaping it and giving her a nose that looks and breathes well, to a rhinoplasty for cosmetic reasons, all of this uses the same principles. Same principles for forehead flap reconstruction, to rhinoplasty, to give somebody the facial nasal shape and contour they desire. All of that is a basis in reconstructive surgery. Just like in trauma, you can reconstruct the face and the nose. In this patient that had a injury from a chainsaw, to a facelift that really gives you that shape and contour that you want, but an elegant look to their face. And this is a patient that had severe facial trauma before her wedding, and of course she was reconstructed and reshaped to a facelift that gives you the shape and contour using the anatomy that you know to restore shape and beauty and restore their beautiful face, and really using these reconstructive techniques. Same with breast reconstruction. You're using the power of the breast reconstruction techniques to that of reshaping somebody's breast with a breast asymmetry for breast augmentation. So the key is to be the best. You have to train with the best. You have to change and keep learning, and you have to fail before you succeed. Those are such important things to remember. And to become a master in anything, you have to have good leaders to help you. And certainly I've had all of these leaders in my career. These are just a list of some of the amazing people I learned from, especially Jack Gunter and Jack Sheen, that really were amazing role models. And certainly that was how we started the Dallas Rhinoplasty meeting with my mentor, Dr. Jack Gunter, and he really helped to transform all of rhinoplasty, culminating obviously in this new edition of the Dallas Rhinoplasty book. So excellence in aesthetic surgery is 3 E's: experience, excellence, and exceptional results. They go hand in hand. The excellence of technical perfection, the experience of wisdom from decades of surgery, and the exceptional results from the fusion of art and science. It's a painful procedure. It's a painful process to do this. But remember, to be the best, you have to not only train with the best, but you also have to give back. You have to teach it. You have to lecture about it. You have to make sure that you help others become better in themselves, and that's called mentoring. And mentoring and teaching is such an important thing. It's been an important part of my life in mentoring hundreds of plastic surgery residents and faculty all around the country, not only in when I was chairman of the plastic surgery at UT Southwestern, to all of my other venues, including my family. You mentor your kids, you mentor your family. My kids are fantastic. And my daughter went from being a world-class ballerina to a first-year medical student. Here she is at our recent white coat ceremony at UT Southwestern. And that really culminates really my career in what I call mentoring and giving back. So I would say the best training by far is reconstructive surgery. It's the DNA of aesthetic mastery. And really it guides everything we do. And it's really not about changing faces. It's about changing lives. That's so important. So as in life, plastic surgery, it's not about the destination. It's the journey that matters. So make sure that when you say you're an expert, it's not an instant expert. It's somebody that has paid the price of patience, perseverance, and hard work to make sure that you truly are a master in what you do. So give us your thoughts, give us your comments and feedback. And remember, helping you become a better and more informed you. Stay tuned and please follow us at Rohrich Knows Best Podcast.